everyone and welcome to today's video lecture. In today's video lecture, I'll be solving previous year's NEET questions and discussing the answers. And this is for the chapter Reproductive Health, and this is part 2 of the series. So if you haven't watched part 1, please do so. Alright, the links will be there in the description box below. Alright, so let's begin. Okay, so question number 1. The present population of the world is about, and you have your options A, B, C, and D, and this appeared in the year 1997. A, 15 trillion, B, 6 billion, C, 500 million, and D, 100 million. Now, this answer is present in NCERT, so I would suggest you just follow the values written in NCERT. So, the present population of the world, and this was in 1997, so it is 6 billion. Okay, so the answer is B. Let's go to the discussion. So these values are taken from NCERT. Okay, and they've said that in the year 2000, it is 6 billion. So it's around that time. In 1900, it was 2 billion. In 2000, it moved up to 6 billion. And in 2011, it moved up to 7.2 billion. Okay, so you can see how it is increasing as the time moves on. Okay, clear? This is factual based, easy. Move on. Okay, so question number 2. One of the legal methods of birth control is, this appeared in NEET 2013. A, by having coitus at the time of daybreak. B, by premature ejaculation during coitus. C, abortion by taking an appropriate medicine. D, by abstaining from coitus from day 10 to day 17 of the menstrual cycle. Okay, so one of the legal methods of birth control is D. Okay, by abstaining from coitus from day 10 to 17 of the menstrual cycle. Okay, so that's around the ovulation period. Okay, so if you abstain from coitus during that time, and if you are sure your menstrual cycle is that many days long, if it's like, let's say like a 28-day menstrual cycle, so day 10 to 17 would be an unsafe time if you don't want to get pregnant. By having coitus at the time of daybreak doesn't make sense. By premature ejaculation during coitus does not make sense. Abortion by taking an appropriate medicine. No, abortion is not a legal method of birth control. Of course, abortion is legal, but it is not a birth control method. Okay, we will come and discuss that later on. So the appropriate answer here is D. So one of the legal methods of birth control is abstinence of coitus during the fertility period. Like I said, if you have a 28-day cycle, so 14th day would be ovulation day. So around that period, you should avoid, you should maintain abstinence. So that is like a legal method of birth control. But abortion is a different thing altogether. Okay, it is not a kind of birth control. So the deliberate termination of pregnancy either by medical or by surgical method before the viability of the fetus is called induction of abortion. Okay, now there are certain laws in India that were made to make abortion feasible for women who did not want to continue their pregnancy. Okay, so in India it's called Medical Termination of Pregnancy Act of 1971. And it is important that you are aware of this. Okay, it's called the Medical Termination of Pregnancy Act, it's MTP, and it was founded or established in 1971. So MTP is safe to perform at 12 weeks. Now you can't do MTP at any time of pregnancy, right? So via consultation of your doctor, MTP is safe to perform at 12 weeks and can be done up to 20 weeks. Okay, but it is safe ideally within 12 weeks. Now provisions for MTP, under what circumstances can MTP be performed? Okay, so there's a continuation of pregnancy would risk life or injure the mother physically or mentally, then MTP is performed. The risk of child being born with serious physical and mental abnormalities, yes, then MTP is performed. When pregnancy is caused by rape, both in major and minor girls and in mentally imbalanced women, then MTP is performed. Okay, sorry. So this is just to help you understand under what circumstances MTP can be done. Okay, but ideally for NEET, just remember MTP is safe to perform at 12 weeks. Okay, and under special circumstances can be done up to 20 weeks. Okay, pregnancy is caused as a result of failure of contraception. So if the mother does not want, or the female does not want to continue because there's a failure of contraception, then she can opt for MTP. Now, medical methods of MTP up to 12 weeks. Now, if the pregnancy is only up to 12 weeks and if the female wants to perform an MTP, she wants it done, then they use medicines. Okay, there are medical methods. There are also surgical methods. I'm just talking about the medical methods. Okay, it include use of mifepristone, misoprostol, methotrexate, and tamoxifen. Okay, these are just names that I'm giving you to help you understand. Okay, what medicines are used to perform MTP up to 12 weeks. Now, up to 13 to 20 weeks, medical methods of MTP include misoprostol. These are all prostaglandin. Okay, medicines that are given to the female. Okay, carboprost and dinoprostol. Okay, these are different types of prostaglandins. All right. So these are the different medical methods of performing MTP. Okay, obviously under the guidance of your doctor. All right, so basically this is what MTP, medical termination of pregnancy, is, and I wanted to make you understand this so that you don't assume that this is a method of contraception. No, if there's a failure of contraception, okay, then, and if the woman wants to opt for abortion, then she can. All right, and there are obviously certain laws placed there, certain circumstances under which MTP can be performed, and obviously the condition in which the pregnancy is, the stage in which the pregnancy is. Okay, so this is completely different from contraception, MTP. All right, so if we go back to our question, I think I've answered the question, right? On the legal methods of birth control is by abstaining from coitus from date to 10 to 17 of the menstrual cycle, right? This is the safest way to abstain yourself, okay, to go about a legal method of birth control, provided you are aware of the menstrual cycle. All right, let's move on. Okay, so question number 3. Medical termination of pregnancy, MTP, is considered safe up to how many weeks of pregnancy? Now, I've just discussed this, right? So if you go back and go through that answer, the discussion, you would know the answer. So this appeared in 2011. A 8 weeks, B 12 weeks, C 18 weeks, and D 6 weeks. So MTP is considered safe up to 12 weeks of pregnancy. Just remember that, okay? If they ever ask you in NEET, you know the answer. Answer is B. So MTP is considered safe up to 12 weeks. I have already discussed MTP in much detail, right? So go back and watch the discussion again. Okay, let's move on then. Okay, so question number 4. Consider the statements given below regarding contraception and answer as directed thereafter. Okay, again this is related to contraception. All right. So first is medical termination of pregnancy during first trimester is generally safe. 2 is generally chances of conception are nil until mother breastfeeds the infant up to 2 years. 3 intrauterine devices like copper T effective contraceptives. 4 contraception pills may be taken up to 1 week after coitus to prevent conception. Okay, so medical termination of pregnancy, MTP, during first trimester is generally safe. Yes, that's right. We've already discussed this. So 1 looks right. Generally, chances of conception are nil until mother breastfeeds the infant up to 2 years. Now, usually breastfeeding is compulsory up to 6 months. So this statement doesn't really seem fitting for the answer, but let's move on. Intrauterine devices like copper T are effective contraceptives. Yes, that's right. So 3. And 4 contraception pills may be taken up to 1 week after coitus to prevent conception. No, that's incorrect. So 4 is incorrect. Which 2 of the above statements are correct? So you have A 1 and 3, B 1 and 2, C 2 and 3, D 3 and 4. So now when it comes to breastfeeding, usually lactational amenorrhea takes place, right? I think I've already discussed this in the previous part. And it's usually done exclusively for 6 months. It can be done beyond that, but I think in this case 1 and 3 seem to be the appropriate answer for this. Okay, and conceptions, generally chances of conception are nil. That's a very a hard hitting statement to make. It's never nil, there are always chances of failure. Okay, so there's never a condition where it's nil. Okay, unless until you abstain from coitus at all, you don't do anything. So that is a very vague statement to make. So 2 doesn't really fit into this contraception statement. So from this 1 and 3 seem to be the appropriate answer. Okay, so the answer is A. Okay, oh sorry, I just forgot to mention this appeared in the year 2008. All right, so let's move on. Empty period in the first trimester is considered safe. Yes, we know that. Now, intrauterine devices like copper T are effective contraception. Okay, so we already discussed this in part 1 in much detail, the different types of intrauterine devices. You can go through that and watch the discussions. Okay, so fairly simple. Yeah, let's move on then. Okay, so question number 5. Select the option including all sexually transmitted diseases. This appeared in NEET 2020, pretty recent. So you need to look for the STD, the sexually transmitted diseases. So you have A, gonorrhea, syphilis, genital herpes. You have B, gonorrhea, malaria, genital herpes. C, you have AIDS, malaria, and filaria. You have D, cancer, AIDS, syphilis. Okay, so the option that has all STDs is A. Okay, it's gonorrhea, syphilis, and genital herpes. All three are types of STDs. So the answer is A. Okay, so I've made a table here which covers all the STDs that will be, matching with your syllabus in NEET. So you can go through them, learn the pathogens that are associated with every disease. Okay, so go through this table. Okay, this table is important because they can ask you, what pathogen is involved in what kind of disease. Okay, or the other way around. So gonorrhea, which pathogen is responsible for that? Syphilis, which pathogen is responsible, and so on. Okay, so yeah. Now, as we move on, I have discussed some of the STDs. Okay, and as we move on in this presentation, in this video, you will see that I have discussed the STDs as and when we are moving on with every question. So I would suggest that for your sake, to help you learn and understand better, note down what I have written and try to learn it. Okay, and if they were ask you what kind of symptom or anything like that, you know the answer. Okay, just to help you understand the different STDs that are there and what are the symptoms associated with every STD. Okay, so for the first we'll discuss gonorrhea, or it's also known as CLAP. It is caused by the non-motile, non-spore forming gram-negative bacteria called Neisseria gonorrhea. Okay, and the organisms can grow singly or in pairs. So now it commonly manifests as cervicitis, urethritis, or proctitis and conjunctivitis. So proctitis is the inflamed lining of the rectum. Okay, so try to understand like what happens if gonorrhea is there in a patient. What are the different types of symptoms that can be found in that patient? Okay, you can see there's cervicitis, there's urethritis, there's inflammation of the cervix, there's inflammation of the urethra, there's inflammation of the rectum. Okay, there can be conjunctivitis also. Okay, that's inflammation of the conjunctiva of the eye. Okay, now in males what we typically find is this acute urethritis. Okay, there's inflammation of the urethra. Okay, that's commonly found in males, and the incubation period after exposure is 2 to 7 days. And some men may remain asymptomatic also. Okay, so many times the male does not know that he is infected with this. Okay, so the major symptom is urethral discharge and dysuria without urinary frequency or urgency. Dysuria is when there's pain while urination. Okay, when there's pain while urination, that dysuria. Okay, and there's also urethral discharge. Okay, initially the discharge is scant and mucoid, and later becomes profuse and purulent. Purulent means it contains pus within day 1 or 2. Initially, it is just scant, okay, it's less, but later on, as days move on within day 1 or 2, it becomes there's a lot of discharge, and also the discharge becomes purulent, that it contains pus in it. And females, this is what we saw in males. In females, there's mucopurulent cervicitis that is common in women. Okay, that means the cervix has a mucopurulent, that's mucus, and it's also pussy. Okay, and the bacteria infects the columnar epithelium of cervix. Bartholin glands also become occasionally infected. Okay, so the bacteria infects mostly the columnar epithelium of the cervix opening. Okay, but and also Bartholin glands can also be infected in certain cases. Okay, so you have to look out for these symptoms, okay, in females. The minor symptoms include scant vaginal discharge flowing from the inflamed cervix and dysuria that is associated with the gonococcal urethritis. Okay, again, there's pain while urination that could be due to urethritis. So this is in females. The incubation period is 10 days of infection and symptoms. Okay, this is not there, supposed to be there. Symptoms are more acute and intense. Okay, so there's a difference between males and females. And women, sorry, the females, the incubation lasts for 10 days after infection, and the symptoms are more acute, okay, and intense as compared to males. Males sometimes they are asymptomatic, so males don't even know, but the females, yes, you can see symptoms in females in the case of gonorrhea. So gonococcal vaginitis occurs in anestrogenic females. Okay, so the bacteria can also infect the vagina in females that are anestrogenic, that means pre-puberty females or menopausal females, okay, where estrogen levels are low in the body. Okay, so this is an interesting fact. This is an interesting fact. The vaginal mucus becomes red and edematous and purulent discharge. Okay, so obviously becomes red, you know what red is. And edematous, yeah, it accumulates fluid, and purulent discharge, that means it contains pus. Okay, the discharge is pussy. All right. So now gonorrhea can also pass from a pregnant woman to the fetus during and also during parturition. Okay, when it is infected. So, for example, a woman is infected with gonorrhea, her cervix is inflamed, right? It has infection. So, when the baby passes through during parturition, the baby can also get infected during that time. Okay, also, when a pregnant woman, it can pass on to the fetus. Okay, so during parturition, when it is exposed to the infected cervical secretions, it leads to a condition called ophthalmia neonatal. Okay, where the eyes of the neonate, that is the newly born infant, is infected. Okay, so this is where conjunctivitis happens. Now, anorectal gonorrhea occurs, that means ano means anus and rectum. Gonorrhea occurs when discharge from the infected cervix spreads to the rectum. Okay, so apart from the cervix, it can also move to the anus and the rectum area. Okay, and yes, that is possible. And there is anorectal pain, there's tenesmus, that is the feeling to pass bowels even though rectum is empty. So you just feel like going to the toilet over and over again, but even though there's nothing really to pass, so that sensation comes in, that's called tenesmus. This purulent rectal discharge, and there's rectal bleeding. Okay, so there are different ways by which gonorrhea infects males and females. Okay. Pharyngeal gonorrhea is usually mild or asymptomatic and is acquired through oral genital exposure. Sorry. So pharyngeal gonorrhea is also present. Okay, it is possible that your oral area can also be infected with gonorrhea. Ocular gonorrhea results from auto-inoculation from an infected genital site. Okay, so this results in swollen eyelid. There's severe hyperemia. That means excess blood in the vessels. Chemosis, the sign of eye irritation, and there is purulent discharge. Okay, so these are the different ways by which gonorrhea can spread. Okay, so in males and females, obviously the genital areas are infected. In females, it can also pass through the fetus, and also while parturition, the inflamed cervix can also transfer this pathogen into the neonate, right? And anorectal gonorrhea also can be, anorectal area can also be inflamed if that pathogen moves from the genital area into the anorectal area. Pharyngeal gonorrhea is also present, is also possible, but it is mild and asymptomatic. Ocular gonorrhea, yeah, the auto inoculation of the from the infected genital site to your eye. Okay, so these are different ways by which gonorrhea can be spread in your body. Now, usually the treatment that is used is ceftriaxone. Okay, this is the medicine that is given and is used for treatment. Okay, clear? So, like I said, for your for your sake, for the sake of the exam, and for your understanding, I would suggest you note this down, go through your notes, read it over and over again, and try to understand, okay, if gonorrhea is there, what are the different types of symptoms that are there, where it can be infected. Similarly, as we go on to the other STDs, you will see, how it progresses. Okay. Now let's go to syphilis. We discussed gonorrhea, now we'll discuss syphilis. Now it is a chronic systemic infection caused by Treponema pallidum. Okay, and it is characterized by periods of active infections and interrupted by periods of latency. Okay, so there are periods where there is active infection and you can see the symptoms, and then there are periods where there is latency where you can't see the symptoms. Now, primary syphilis, a chancre. Now, chancre is a painless ulcer. It usually begins as a painless papule and is located on the penis in men and women. It is found in the cervix and labia. Okay, so there's a regional, that is one symptom, okay, in primary syphilis. There is also swelling of lymph nodes. So there's regional lymphoadenopathy that appears within 1 week of lesion onset. The chancre generally heals within 4 to 6 weeks, but lymphoadenopathy may occur for months. Okay, so initially the chancre will heal, but the swollen lymph nodes will remain there for months. This is the primary syphilis. Now it will progress into secondary syphilis. Now, in secondary syphilis, what do we see? There's manifestations include mucocutaneous lesions, that is skin and mucous membrane. Okay, the lesions, spots begin to appear on the skin and the mucous membranes. Okay, and there is non-tender lymphoadenopathy. Skin rash appears, which can range from being macular. Macula means distinct discolored area of skin. Papular, raised area on the skin, and pustular, small bumps containing pus. Okay, so it can range from being macular, papular, or pustular. Okay, so these rashes begin to appear on the skin. This happens in secondary syphilis. So initially they are pale red or pink. They are non-pruritic macules and progress to papular lesions. Okay, so this progresses with time. The symptoms include sore throat, fever, weight loss, malaise, anorexia, headache, meningismus. That is, meningismus includes 3 symptoms. Okay, remember this is not meningitis. Meningitis is different. This is meningismus, okay, where neck stiffness occurs, headache occurs, and photophobia also occurs. As phobia towards light. Okay, so meningismus also occurs in secondary syphilis. The secondary stage resolves within 1 to 6 months. A primary syphilis, we see that it heals within 4 to 6 of the lymphoadenopathy, then progresses into the secondary syphilis stage also. A second stage usually resolves within 1 to 6 months. Now, what is latent syphilis? Now, the absence of clinical manifestation of syphilis indicate latent syphilis. Now, sometimes in between there'll be a period of latency, okay, where you don't see these clinical manifestations of syphilis. So the person assumes he or she has healed, but it's not true. The infection is still there inside your body. So this is how the syphilis pathogen works. The early latent syphilis is limited to first year after infection, and latent syphilis is more than 1 year. Okay, so now it's divided into two parts. There's an early latent syphilis and there's a late latent syphilis. Okay, so the early latent syphilis is limited to the first year after infection, and late is more than 1 year. Now, pregnant women with latent syphilis may infect the fetus in the uterus. Syphilis may be transmitted through a blood transfusion or organ donation from patients with latent syphilis. That's another way also of syphilis being transmitted. Now, what is neurosyphilis? Okay, now the CNS syphilis can occur during early invasion within first weeks or months of infection, from months to years. Okay, so the CNS begins to get involved during syphilis. Now we saw the other ways by which syphilis is infecting the body, right? You see the skin rashes, you see lymphoadenopathy, you see chancre, painless ulcer. But the CNS also begins to get involved. Okay, the CNS syphilis can occur during early invasion. It's called neurosyphilis. Okay, during early invasion within first weeks or months of infection, 2 months, 2 years. Now, asymptomatic neurosyphilis patients lack neurological symptoms but have CSF abnormalities, okay, cerebrospinal fluid. It may be found in primary and secondary syphilis. Okay, so in the case where if a person is in the primary syphilis stage or in the secondary syphilis stage, it may appear asymptomatic, but there are actually abnormalities happening in the CSF. Now, symptomatic neurosyphilis include meningeal, meningovascular, and parenchymatous syphilis. Okay, that means it's occurring the meninges of the brain. Okay, and the soft tissues. Okay, of the CNS. So, this is where symptomatic neurosyphilis is seen. Okay, asymptomatic is when you don't know what is happening, but there is an infection. You can't see any symptoms, but that happens in certain patients. Certain patients, it can also be symptomatic. Okay, in that case, the meninges of the brain are being infected, and in this inflammation, and also in the soft tissues. Now, the onset of symptoms can range within less than 1 year up to 30 years after infection. Okay, so it can go on for a long period of time. Now, some of the symptoms include headache, nausea, vomiting, neck stiffness, seizure, and changes in mental status. Late syphilis complications include cardiovascular syphilis, which appears 10 to 40 years after infection, and late benign syphilis, which are solitary lesions. Okay. Now, there can be congenital syphilis also. That means the baby is born with syphilis. Okay, so transmission of pathogen from an infected mother to her fetus across placenta can occur at any stage of pregnancy. We already discussed that. So, fetal damage begins to occur after 4th month of gestation. So, there's adequate treatment of mother before the 16th week of pregnancy should prevent fetal damage. Now, untreated maternal infection may result in fetal loss, prematurity, neonatal death. Okay, so these are the complications that can occur if syphilis is not treated in the mother. The syphilis can be treated with antibiotics. Okay, penicillin is usually given to patients to treat syphilis. Okay, so syphilis is a pretty long disease. Okay, it's there are different stages, and also there's a stage of latent syphilis. There's neurosyphilis also gets involved in the primary and the secondary stages of syphilis. And of course, we there is congenital syphilis also. If the mother is untreated, then it could lead to a lot of problems. Sometimes, yeah, if the infected mother, as in the doctor finds out that the mother is already infected while she's pregnant, then they can perform a treatment to help get rid of it. So yeah, syphilis, like I said, is a pretty long, like cardiovascular syphilis, which appears 10 to 40 years after infection. Okay, so this can go on and on for years. That's why it is important to be careful. Okay, so I mean, apart from contraception, yes, that is one way to avoid pregnancy, but you need to also be careful when you are with a partner, because then you could come across these kind of STDs which will affect your health and your partner's health. So syphilis can be treated with antibiotics. All right, so let's talk about genital herpes. It's caused by a DNA virus, HSV1 and HSV2. Now, oral facial infections. Okay, let's go through that. HSV1 spreads via oral facial infections. There's gingivostomatitis, that is the oral area is infected, and pharyngitis, it is obviously a pharynx, are common in first time infection. It is caused by HSV1, herpes simplex virus. That is what HSV is. It is commonly seen in children and young adults. Symptoms include fever, malaise, myalgia, inability to eat, irritability, and cervical adenopathy, which is swelling of lymph nodes around the neck, which lasts for 3 to 14 days. Now, genital infections. One way by which herpes can spread is oral facial infections. The others is what we're talking about is genital herpes is genital infections. Okay, oral facial infection is different. It is caused by HSV1. Now we're talking about how herpes can infect your genital area. It is caused by HSV1 and HSV2, but the recurrence rate of genital herpes is more with HSV2. Okay, usually we say HSV1 is causes the oral facial infections, and genital is caused by HSV2, but it's not always true. But just that the recurrence rate is more in HSV2. Okay, in the case of genital herpes, it is manifested by endometriosis and salpingitis. Okay, salpingitis is inflammation of fallopian tube in women, and prostatitis in men. Okay, that's inflammation of the prostate gland. Now, HSV2 also causes meningitis, cervicitis, and urethritis. HSV1 and HSV2 causes rectal and perianal infections. Proctitis symptoms include anorectal pain, anorectal discharge, tenesmus, and constipation. Okay, so these are some of the symptoms that are seen and what it causes. Now, acyclovir or Zovirax is an oral drug that is used to treat herpes. Apart from that, there is symptomatic treatment, and also it is advised to abstain from sex. Okay. And very important thing to remember, it is not curable. Okay, it is not a curable disease. So it is very important that you are aware of this and your partner is aware of this, and you don't spread it to others. Oh, sorry. Let's go back to the question. I think I've discussed 3 STDs here, which were related to the answer that we discussed, right, in that question. Let's go through the question. It's a pretty long answer, but I think it must have been useful for you, because now you can just note these down in your notebook and learn them. Select the option including all STDs. That's gonorrhea, syphilis, and genital herpes. Okay, these three are definitely STDs. B, C, and D, all the options don't match with STDs. Okay, so question number 6. Which of the following sexually transmitted diseases is not completely curable? Okay, and this appeared in NEET 2019. A. Chlamydiasis, B. Gonorrhea, C. Genital warts, and D. Genital herpes. We just discussed this, right? So, which is not completely curable is genital herpes. Okay, so the answer is D. Now we already discussed genital herpes, so I'm not going to go through that again. Please go and watch my discussion previously. But I will discuss the other STDs that are mentioned in the question here. So chlamydiasis and genital warts, because gonorrhea is also discussed previously. So I'll discuss A and C. Okay, what is chlamydiasis? What is genital warts? All right. So now chlamydiasis. It is caused by Chlamydia trachomatis bacteria. Okay, and it is the most common type of STD found. Okay, chlamydiasis is the most common type of STD found. Now, it is found to be similar to gonococcal infections. We already discussed gonorrhea. So, right, when there's a diagnosis done, there's both checked, chlamydia and gonorrhea. Okay, they are very similar. Okay, and include urethritis, proctitis, and conjunctivitis in males and females. This epididymitis is seen in males, that is inflammation of the epididymis, and mucopurulent cervicitis. Okay, that is a mucoid pussy discharge. There's acute salpingitis, bartholinitis, perihepatitis, inflammation, that is inflammation of the liver capsule and adjacent peritoneum in women. Okay, so look at it that way. In males, what happens, and in females, what happens. Now, this over here is a diagram of the life cycle of the bacteria. Okay, I've just put that for your information. So what happens is this, for example, this is a cell, okay, and this uptake of the chlamydial EBs. Now EBs is actually elementary body. Okay, it's called elementary body, and they go inside the cell. Okay, and they turn into reticulate bodies. You see how they are now replicating inside, okay, as the in the form of RBs is reticulate bodies. All right, and then again the conversion of RBs to EBs is done, and these EBs are released. Okay, now these EBs, once they are released, they go infect another cell. Okay, so now EBs enter, they get converted, they replicate, they get converted to RBs. Okay, and then the RBs again get converted to EBs and are removed. Okay, and they go then attached to into another healthy cell. Okay, so that's how they begin to infect all the cells. Now it has been found that when there is cytokines, okay, like interferon gamma exposure, okay, there is a temporary stop, okay, for RBs to convert to EBs. Okay, so now for example, if there was an exposure to a cytokine, that is interferon gamma, okay, the RBs don't get converted to EBs, but as soon as that exposure is removed, then they go on performing the same cycle again. Okay, so basically the whole life cycle happens inside this cell. Okay, EBs come, convert to RBs, again RBs get converted to EBs and are removed out, okay, into the to move on, attached to another cell. So this is but just to help you understand. It's not very important to remember this, but I just thought it will help you understand how chlamydiasis works. What is the life cycle of chlamydiasis? Okay, and like I said, it is very similar to gonococcal, like gonorrhea, gonococcal infections, and most of the symptoms are similar to that in males and females. Obviously, there is some difference, so I'll suggest you note that down. Okay, and in case you're curious to know, I have taken this book called Textbook of Internal Medicine by Harrison. But you'll probably come across this when you're studying medicine, so don't stress too much on this, just to help you understand how chlamydiasis functions. Don't worry with respect to NEET. All right, so we can move on. In pregnant females, during parturition, the infant can get infected when exposed to the infected cervix, causing infection of eye, like we discussed in gonorrhea also. Okay, so this is chlamydiasis. Treatment include tetracycline and doxycycline. All right. Let's discuss genital warts. Now, anogenital warts is condyloma acumanatum, very big word, but basically we just stick to anogenital warts. Is caused by human papilloma virus, okay, also known as HPV. Okay, so genital warts is caused by human papilloma virus. Okay, in adults, there's orogenital sexual contact that may transmit the disease, and in children, it is acquired from the infected mother genital tract, causing respiratory papillomatosis. Okay, it is a wart-like growth or tumor on surface of the larynx. Okay, so that is how it spreads. In adults, it is via orogenital sexual contact. Okay, and in children, it is acquired from the infected maternal genital tract. Okay, causing respiratory papillomatosis, okay, which is a wart-like growth or tumor on surface of the larynx. Okay, so anogenital warts develop on the skin and mucosal surfaces of the external genitalia and perianal areas. Okay, these warts cause itching and occasional bleeding. The incubation period is usually 3 to 4 months. And pap smears of cervical or anal scraping show cytological evidence of HPV. Okay, so these wart like structures grow there, and they can cause itching or sometimes occasional bleeding. Sorry. So pap smears are usually done where they take scraping of the cervical and the anal area, where they can then check if there is an infection or not. And the incubation period is usually 3 to 4 months. Now, high-risk HPV types cause infections that are associated with squamous cell carcinomas and dysplasia. This abnormal type of cells of penis, anus, vagina, and vulva. Okay, there are also high-risk type HPV types also that can cause infection. Now, some of the treatments include cryotherapy with liquid nitrogen, trichloroacetic acid weekly, surgical excision, laser surgery, interferon administration. Okay, so these are type of treatments that can be used. HPV vaccines are available, which are very important, and they have reduced the rate of infection disease produced by the HPV types. Okay, so they are known to be effective in preventing any infection. Okay, so you can avoid an infection by taking the HPV vaccine. Okay, so clear. So this is genital warts. Unfortunately, I can't show you photos of any of these STDs. That probably get my video will probably get deleted. But you'll come across this on the internet or any medical textbook. You'll come across all the different kinds of STDs and how they actually appear. And you'll probably study this in medicine. So don't spend too much time. Just understand what are the different STDs and the pathogens that are associated with it, and what are some of the symptoms that are associated with this. Okay. All right. So I guess I've answered the question already, and I've already discussed most of the STDs already now. So go through that, and we'll move on to the next question. Question number 7: match the following sexually transmitted diseases with their causative agent. Okay, and select the correct option. NEET 2017. So gonorrhea is Neisseria. Discuss this. Syphilis is treponema. Genital warts is human papilloma virus, and AIDS is HIV. Okay, so gonorrhea is Neisseria A2. Okay, here B3, yeah, C4 and D1. So your answer is actually option D. Answer is D. So I've already put a table, I think, question in the first few questions where I've put the STD and the causative agent. So learn that table that you need to mug up. You should know which causative agent is associated with which STD. Okay, now AIDS I have not discussed, and I will not discuss this in too much detail here because when we go through human health and disease, AIDS is discussed in much more detail over there. Okay, because it is again not just an STD, it can be transmitted via many other ways, and the way in which HIV works is different. So I've just given a brief here. Okay, so now AIDS is, it is caused by HIV, human immunodeficiency virus, and is transmitted via sexual intercourse, blood transfusion, and infected needles of drug users. It infects cells that contain CD4 receptors. Okay, so there are certain immune cells which contain receptors called CD4. Okay, and HIV infects those cells. Okay, and pregnant females, HIV infection can be transferred from an infected mother to the fetus during delivery or by breastfeeding. Okay, so during delivery, the doctors have to be very careful if they know that the mother is HIV infected. Okay, so this is just a brief. Okay, I will not go into the life cycle of HIV, which I will discuss in human health and disease. Okay, but just understand HIV, AIDS is caused by human immunodeficiency virus HIV. Okay, let's move on then. Okay, so question number 8. Which of the following is not a sexually transmitted disease? Okay, this appeared in 2015 as a cancelled exam. A. Trichomoniasis, B. Encephalitis, C. Syphilis, and D. AIDS. So, following is not a STD, that is encephalitis. So, answer is B. Encephalitis is actually the inflammation of brain. It is not an STD. Okay, the remaining were all STDs. So, AIDS, trichomoniasis, syphilis are STDs. Okay, so I have not discussed trichomoniasis till yet, right? I've discussed most of the other STDs. So we'll go through trichomoniasis, and it's caused by Trichomonas vaginalis. Okay, it is a protozoal parasite and it inhabits the lower genital tract of females and urethra and prostate of males, and it is acquired by direct contact or by sexual transmission. Now, in males, the infections are asymptomatic. Some develop urethritis, epididymitis, or prostatitis. In females, the incubation period is 5 to 28 days, and the symptoms include odorous vaginal discharge, which is yellow in color, vulvar erythema, which is skin rash due to injured blood capillaries, itching, dysuria, that is painful urination, and dyspareunia, which is painful coitus. Okay, so these are some of the symptoms that are seen in males and females. Okay, and metronidazole and tinidazole are effective, okay, medicines against trichomoniasis. Okay, like I said, I've explained in the previous STDs. Note this down. I've tried to summarize everything in point form, so it's easy for you to remember. Okay, if they ever ask you anything related to the symptoms, obviously causative agent is very, very important. We've seen they ask you causative agent, they're not really focused more on the symptoms, but just for you to understand. Okay, all right, clear. Let's move on to the next question. Question number 9. Which one of the following statements is correct regarding STDs? Okay, this appeared in Karnataka NEET 2013. A person may contract syphilis by sharing milk with one already suffering from the disease. B. Hemophilia is one of the STDs. C. Genital herpes and sickle cell anemia are both STDs. D. The chances of a 5-year-old boy contracting a STD are very little. So is correct to define the correct statement. So a person may contract, but by sharing milk, syphilis will not be contracted to another person. So A is incorrect. Hemophilia is one of the STDs, that is incorrect. Hemophilia is not an STD. Genital herpes and sickle cell anemia are both STDs, that's incorrect. Genital herpes is, but sickle cell anemia is not an STD. The chances of a 5-year-old boy contracting a STD are very little. Yes, STDs don't just happen like that. Okay, you can't just fall sick. Obviously, there has to be a sexual contact. So unless until the boy is abused uh, which happens in rare cases, but a normal boy, healthy boy, will not contract an STD just like that. So the answer is D. So hemophilia is the inability of the blood to clot normally and is genetically inherited. Okay, so it's a genetic disease, not an STD. Syphilis cannot be transmitted via sharing food or drinks. Sickle cell anemia is not an STD and is an inherited disorder. The chances of a 5-year-old boy contracting STD are less. Okay, so yeah, little vague kind of options, but yeah, this is it. Okay, so this is the answer. All right, let's move on. Okay, so question number 10. Which one of the following does correctly match a STD with its pathogen? Okay, it's appeared in 1994. A. Syphilis, Treponema pallidum. Yes. B. Gonorrhea, Entamoeba histolytica. No. C. Urethritis, Bacillus anthracis. No. D. Soft sore, Bacillus brevis. No. Okay, so correctly matching is A. Syphilis, Treponema pallidum. Okay, I've discussed most of it. It's caused by Treponema pallidum. Now, soft sore I haven't discussed. It's actually called chancroid. Okay, and it's caused by bacteria Haemophilus ducreyi. Okay, it's caused by this bacteria Haemophilus ducreyi. So it's a type of STD again. So it is caused by a gram-negative bacteria and is transmitted as a result in the break of epithelium during sexual contact. Okay, there's an incubation period that's 4 to 7 days with the onset of papule with a rash, and in 2 to 3 days it evolves into a pustule. Okay, that's a pus containing. The pustule ruptures and forms an ulcer. The ulcer bleeds and are painful with little or no inflammation. Okay, half of the patients develop enlarged tender inguinal lymph nodes. Treatment include azithromycin, ceftriaxone, ciprofloxacin, or erythromycin. Okay, so these are the soft sore is also known as chancroid. Okay, so this is another STD that I've discussed. So I've discussed most of the STDs except for AIDS, which I will discuss later on in Human Health and Disease in much more detail. Now, Bacillus anthracis causes anthrax. Okay, so that was the incorrect option there. Alright, so I think I've discussed, I've answered the question that correctly matches is A. syphilis. Yeah. So now you understand that it is very important that you remember the causative agent against any kind of STD that I've listed in the table, because they can ask you anything. Alright, so question number 11. In which of the following techniques the embryos are transferred to assist those females who cannot conceive? Okay, and this appeared in NEET 2020, it's pretty recent. The embryos that are transferred to assist those females who can not conceive. Okay, so A, ZIFT and IUT, you're supposed to know the full forms. B, GIFT and ZIFT, C, ICSN, ZIFT, and D, GIFT and ICSI. Now, ZIFT is zygote intrafallopian transfer, and IUT is intrauterine transfer. Now, embryos are transferred to those to assist those females who cannot conceive is the ZIFT and IUT techniques are used. Okay, we'll come and discuss that in detail later on. So the correct answer here is A. GIFT is gamete intrafallopian transfer. So the gamete is transferred, not the embryo. Now ZIFT, I've already said the full form. Zygote intrafallopian tube is when an early embryo or zygote with up to 8 blastomere is transferred to a fallopian tube, and embryos with more than 8 blastomere is transferred into the uterus. So if it's a zygote or if it's an early embryo, it is transferred into the fallopian tube, and if it is more than 8 blastomeres, it is transferred into the uterus. Okay, and intrauterine transfer is the process of transferring the embryo zygote into the uterus, right? It also forms a part of the test tube baby program. Okay. program. So it is important that you know all the full forms, and as we progress you will come across these terms again. Okay, so let's move on. So question number 12. Okay, so question number 12. In case of a couple where the male is having a very low sperm count, which technique will be suitable for fertilization? This appeared in NEET 2017. A, gamete intracytoplasmic fallopian transfer. No. B, artificial insemination. Yes, that's one way. C, intracytoplasmic sperm injection. That is also another way. D, intrauterine transfer. No, that doesn't make sense. So A and D don't make sense. Artificial insemination is when the sperm is directly put into the genital tract of the female, and intracytoplasmic sperm injection is done in a lab. So these are two ways by which, if the male has a low sperm count, then they can use this technique to perform fertilization. Okay, so I think there should be two appropriate answers here, B and C. So the answer is B and C here. Okay, so artificial insemination is a technique which is used due to infertility of male or low sperm count. The sperm of the semen of the male partner or a healthy donor is artificially introduced into the vagina or into the uterus of the female. Okay, that's intrauterine insemination. In ICSI, the sperm is fused with an ovum using a microscopic needle, and the embryo is then transferred into the uterus. Okay, so these are two ways by which, if the male has a low sperm count, then fertilization can be performed. All right, let's move on then. Question number 13. Embryo with more than 16 blastomeres formed due to in vitro fertilization is transferred into, NEET 2016, appear there, with more than 16 blastomeres. Okay, so it's a late embryo stage, can be transferred into the uterus. Okay, so the answer is A. Embryo with 8 to 16 blastomeres transferred into the uterus. Okay, so it's not an early embryo, it's a little late embryo, so transferred into the uterus where implantation will then take place. Okay, question number 14. A childless couple can be assisted to have a child through a technique called GIFT. The full form of this technique is, appeared in 2015. A, gamete internal fertilization transfer. No. Germ cell internal fallopian transfer. No. C, gamete inseminated fallopian transfer. No. D, gamete intrafallopian transfer. Yes. Okay, so the answer is D. That's the full form of GIFT. So that's full form of GIFT is gamete intrafallopian transfer. Okay, so it is the transfer of an ovum collected from a donor and transferred to another female who cannot produce one, and provided with a suitable environment for fertilization. Okay, so that's basically what GIFT is. All right, let's move on then. Okay, so question number 15. Assisted reproductive technology IVF involves transfer of, and this appeared in 2014. A, ovum into the fallopian tube. B, zygote into the fallopian tube. C, zygote into the uterus. D, embryo with 16 blastomeres into the fallopian tube. So IVF usually involves transfer of zygote into the fallopian tube. That's the appropriate answer. Embryo with 16 blastomeres will be put into the uterus, not into the fallopian tube. Zygote does not go into the uterus. Ovum into the fallopian tube. No. Okay, so the answer here is B. Okay, so answer is B. Let's go to the discussion. Now, what is IVF? IVF is where the ovum is combined with the sperm in a laboratory dish. It's in vitro fertilization, not in vivo. So it doesn't happen inside the body. The fertilization happens outside the body. Okay. Now, once the fertilization has occurred, the embryo is developed for 3 to 5 days before transferring it into the uterus. Okay, so basically this is what IVF technique is. All right. Let's move on then. Okay, so question number 16. Artificial insemination means, this appeared in NEET 2013. A, artificial introduction of sperms of a healthy donor into the vagina. B, introduction of sperms of a healthy donor directly into the ovary. Transfer of sperms of a healthy donor to a test tube containing ova. D, transfer of sperms of husband to a test tube containing ova. Artificial insemination artificial introduction of sperms of a healthy donor into the vagina. That's the appropriate answer. Okay, that's what artificial insemination means, and we already discussed this also. So the answer is actually A. Okay. So it is a technique which is used due to infertility of male or sperm count. It's just the same answer. Okay, where this sperm of the semen of the male partner healthy donor is artificially introduced into the vagina. Okay, clear? Let's move on. Okay, question number 17. Stage transferred into the uterus after induced fertilization of ovum in the laboratory is Karnataka NEET 2013. A. Embryo at 4 blastomere stage. B. Embryo at 2 blastomere stage. C. Morula, and D. Zygote. Okay, so the stage transfer in the uterus is usually when it is a morula. Okay, so the answer is C. Okay, so yeah, once the fertilization has occurred, the embryo is developed for 3 to 5 days. That's the morula stage before transferring it into the uterus. Okay, that's in vitro fertilization. So if we go back to the question, yeah, the stage transferred into the uterus after induced fertilization of ovum in the laboratory. Okay, clear? Same answer. Question number 18. The test tube baby program employs which one of the following techniques? This appeared in 2012. A. Intracytoplasmic sperm injection. No. B. Intrauterine insemination. No. C. Gamete intrafallopian transfer. No. D. Zygote intrafallopian transfer. Yes, that's what the test tube baby program employs. ZIFT. So the answer is D. So again, the test tube baby program, the ova from the female donor and sperm from the male donor are induced to form a zygote under simulated conditions in the laboratory. ZIFT is when an early embryo is zygote with up to 8 blastomeres transferred to a fallopian tube, and embryo with more than 8 blastomeres transferred into the uterus. Okay, so this is what ZIFT is. Alright, clear? Simple, same answer. Question number 19. The technique called GIFT is recommended for those females, it's appeared in mains 2011, A, who cannot produce an ovum, B, who cannot retain the fetus inside uterus, C, whose cervical canal is too narrow to allow passage for the sperms, D, who cannot provide suitable environment for fertilization. So gamete intrafallopian transfer, you can see from the name itself. The gamete is transferred to the fallopian tube. So those females who cannot produce an ovum, GIFT is used, where the ovum is put into the fallopian tube of the female. So the answer is A. Okay, the full form of GIFT is gamete intrafallopian transfer. Okay, it is a transfer of an ovum collected from a donor and transferred to another female who cannot produce one and provided with a suitable environment for fertilization. All right, so this is it for GIFT. Let's move on. Question number 20. In vitro fertilization is a technique that involves transfer of which one of the following into the fallopian tube? This appeared in 2010. A, embryo only up to 8 cell stage. Either zygote or early embryo up to 8 cell stage. C, embryo of 32 cell stage, and D, zygote only. So in vitro fertilization allows which one of the following into the fallopian tube. Okay, so either it will be a zygote or an early embryo. Okay, so the answer is B. Okay, the answer is B. If it's at a later stage, then it is put into the uterus. Okay, so yeah, either zygote or an early embryo is transferred into the fallopian tube. All right, let's move on. Question number 21. Test tube baby means a baby born when? It's appeared in 2003. A, it is developed in a test tube. No, it is developed through tissue culture method. No. C, the ovum is fertilized externally and thereafter implanted in the uterus. Yes, it develops from a non-fertilized uterus. No. So test tube baby actually means when the ovum is fertilized externally, and then after that it is implanted in the uterus. Okay, so the answer is C. Okay, it's the same answer, so I won't discuss this again. Okay, the test tube baby means when the fertilization is done externally and the embryo is transferred into the uterus. Okay, next. The test tube baby means, again, it's a repeat of the previous question. This appeared in 1996, so it's important that you remember what test tube baby is. Okay, the test tube baby means fertilization development both in uterus, B, fertilization in vitro and then transplantation in uterus, C, baby grown in test tube, D, fertilized and developed embryo in test tube. No, that's incorrect. So the answer is B. Fertilization happens in vitro and then transplantation in uterus. Answer is B. So IVF is where the ovum is combined with the sperm in a laboratory dish. Okay, so then the embryo is developed for 3 to 5 days and then transferred into the uterus, or a zygote is transferred into the fallopian tube. That is ZIFT technique. Test tube baby means when the fertilization is done externally and the embryo is transferred into the uterus. Okay, next question. Question number 23. Which of the following statements is correct with reference to a test tube baby? Again, another test tube baby question. So this is important. This appeared in 1994. A, fertilization of the egg is effected outside the body. The fertilized egg is then placed in the womb of the mother where the gestation is completed. B, fertilization of the egg is effected in the female genital tract, which is then taken out and grown in a large test tube. C, a prematurely born baby is reared in an incubator. D, fertilization of the egg and growth of the embryo are effected in a large test tube. So it is obvious that answer A is correct. If you've been following all the previous questions, they're all related to test tube babies. So fertilization of the egg is effected outside the body, and the fertilized egg is then placed in the womb of the mother where the gestation is completed. Okay, so the answer is here A. Okay, clear? This is again same question. Oops, sorry. Test tube baby means when the fertilization is done externally and the embryo is transferred into the uterus. Alright, clear? This was again direct question. Okay, so we've come to the end of this video lecture, and I hope you've enjoyed today's video lecture. I hope you've learned something new today. And please don't forget to like, share and subscribe to MG NEET Biology. And I'm available on Facebook, Twitter and Instagram, so you can follow me there for more updates. And the links will be there in the description box below. And I'll see you in the next video lecture, alright? So, bye.